Hi guys, this is Kimba. I'm manager over at Lovelace Labor of Love, and I'm here to give you your hospital tour. Let me show you a little bit around outside the hospital. I wanted to show you the front of the hospital. This front circle on Montgomery is what we call the main entrance. Non-pregnant patients, so like our other patients, are expected to come in through this door. Our pregnant patients, we want to pull up to the little circle underneath the area where our name is. That is the Family Birthing Center entrance. And that is where we want you, our pregnant mamas, to come. This is the view when you get off the elevator. You may arrive and have those doors closed, and that's okay. You can see, just like the front door, if it's after hours, there's a little bell, and you can ring the bell and ask for help. Once you get in through the doors that are to the left of the elevators, you will see the signs for OB triage. Most of our moms are directed to OB triage, and here is one of our rooms for you to look at. You can see, like the rooms downstairs that you'll go to after the baby, the medical equipment is in cabinets. Because this is a laboring area, the odds are the cabinets will be open and you might be attached to some of these things. There's oxygen, IVs, pumps for your epidural if you choose the epidural route. If you choose a natural birthing option, this is one of our rooms that also has a jetted tub. So with the jetted tub option, you can labor in the tub as long as your medical situation provides for that. We call these pandas. That's a particular brand we use. It's a warmer, and it also gives us a way to give baby-sized oxygen, suction. We can do some weights. We have various options of what we can do for your baby. Realistically, if you are having a normal delivery and baby and you are both doing fine, baby will go from being born to being placed on your chest without interruption. And things like weights, measures, and routine medications can wait a little bit. If we are worried about your baby in any way, baby will go over here to the warmer, where we have a little bit of room to work. We also have balls, we have birthing bars, we have lots of different things depending on what you need and what is appropriate for your medical situation. On this side of the room, we have what we call our whiteboards. So you can see we put your name, we recognize what your top concern is. We make sure you have phone numbers so that you can use the bedside phone to call your nurse, your tech. We mark off when we check you for comfort, and if your pain is not under control, we come up with a plan with you to determine what you want to do and what we can do that is safe for you and baby to manage your pain. Our labor and delivery unit has a dedicated surgical suite for those instances where you may require a cesarean delivery or a surgical delivery. The recovery room is nearby, as are educators, nurses, nutritionists, whatever services you require. If there are any concerns about your baby during delivery, we do activate the NICU team, and they are present in your room when your baby's born so that your baby has dedicated NICU staff. 24 hours a day, you can get in through the front doors. If it's after 7 o'clock, these inner doors are closed and locked. But there's a purple sign off to your right. You are welcome to ring the bell, and someone will help you. So this is our lobby. During a public health situation like we have right now, we are not allowing people to just hang out in the lobbies as we normally would. So you'll see our lobby's pretty bare. Everyone that's in here is in the patient rooms with their loved ones, and that's what we would expect from you. This is the front desk when you come in. They'll ask you some questions, get your pre-reg stuff taken care of, get you activated, have folks help you get to where you need to go. And if you are coming in and in active labor, make sure to say something when you come to the desk. This is the Family Birthing Center, and today we're going to go into one of our rooms so you can see what your experience will be like. We have this wonderful couch that turns into a bed for your loved ones. Any medical equipment that might be needed to care for you while you're here are inside these cabinets. So you don't have to look at them if you don't need them. We have a special menu that you'll be provided. We have room service, so you'll be able to choose whatever it is that you want and when you want it. And there's a rocking chair for you or your loved one. That is a standard postpartum room, and postpartum just means the room you go to after you are done with your recovery time after initially having your baby. A few steps outside of the Family Birthing Center on the first floor is our cafeteria. We are discouraging folks from spending a lot of time in the cafeteria, so please talk to your nurse about meal options for your loved ones while we are on special precautions. So if you choose to come in the front door instead of the Family Birthing Center door, you will be greeted by a screening table. And at the screening table, our wonderful staff will ask you about your history and check you for a temperature and then help you decide where you need to go next. This is our main hospital lobby. This is the way you would go towards your clinic appointment. I wanted to introduce you to the folks you talk to on the phone all the time at Labor of Love. While we are going through these enhanced precautions during our public health issues around COVID-19, we only have 3 ways for you to get in the hospital. That's why I showed you the front circle. You can come in through the main lobby until 7 p.m. After 7 p.m., that entrance is locked. Family Birthing Center entrance is manned 24/7. Everyone who enters is screened. We get a health history screen. We ask about travel. We ask about household contacts, and we check your temperature. Once everybody screens appropriately, we then take them where they need to go. Know that if you need to come in and you are not here as a patient and you are not here in labor, then maybe you're coming to be an ER patient. If you're coming to be an ER patient, go around to the north side of the building and you'll see the signage for our alternate entrance. Folks who have respiratory symptoms or screen in as at risk for COVID-19 go in one direction, and then the other folks go in another direction, so that we keep everyone separate so that we decrease the risk of, catching things just by being in the same room. Know that Labor of Love would normally give you a packet of information, so we're going to send that to you by email. And that information includes stuff around supports after pregnancy and delivery, some stuff about lactation, home visiting if you want some parenting support. We have so much rich material that we give. And also just how to stay linked with us throughout the year. We're also still sending you out your emails that you get weekly that allow you to get information based on where you are in your pregnancy or the first year of your child's life, which is pretty fabulous. We also send monthly newsletter, Spirit of Women. You are automatically enrolled in Spirit of Women as we have health events for things other than pregnancy. You will also hear about those. We hope to resume in-person classes, support groups, fitness workouts, as well as our health fairs very soon. Our goal is for you to have the healthiest pregnancy possible, so all these changes that are super stressful are not meant to stress you out. They're meant to keep you and everybody else safe and healthy. I hope to see you guys soon. Have a wonderful day. Thank you so much for choosing Lovelace and Labor of Love and our Family Birthing Centers. Take care.